Almost half of the doctors in the United Kingdom might be buying their own protective equipment, according to a survey. The survey claims that doctors are relying on donations for protective gear. The survey of more than 16,000 doctors was conducted by the British Medical Association. The organization called it one of the biggest surveys conducted on frontline National Health Service staff. Many doctors even claim that they do not feel fully protected on the front lines. 65% feel only partly protected or not protected at all. General practitioners are among the worst hit. 55% of them said that they had to source their own equipment, compared with 38% of other hospital doctors. While the survey shows that supplies were improving, it has not reached a point where all staff feel that they are adequately protected. More than 28% of doctors even said that they were suffering from depression, anxiety and burnout worsened by the working conditions. Meanwhile, in a statement, the government said it was working around the clock to ensure that PPEs are delivered to healthcare workers. The UK government says it supplied more than 1 billion items since the outbreak began. And on Sunday, a plane carrying 10 million pairs of surgical gloves arrived from Malaysia. This latest delivery comes as the National Health Service tries to meet the demand as infected cases continue to surge in the UK.
Fine. Okay.
WION's London Bureau Chief Mandy Clark now joins us live with the latest from the ground. Mandy, talk to us. This is a situation that Britain faces probably worse off as compared to other countries as well, because that's what the survey seems to say, that the National Health Service is chronically lacking in protective gear.
Yeah, it is a devastating survey that was done by the British Medical Council. That is the association that really represents all doctors in the UK, and their findings were really shocking. What we noticed this tension between the daily COVID briefings that the government were putting out, saying that, you know, all the frontline workers what they need, to then medical staff talking to the media saying we simply don't have enough, we're running out. That was an ongoing kind of conflicting messaging. When Boris came back after his illness, he said he recognizes there were major failings, but they're going to work on it day and night. But still, already 120 NHS staff have already died from the coronavirus. And at one point, there was a bit of a scandal that was reported by a BBC report called Panorama that said the way they were counting PPE, that a pair of gloves would count as 2 items. So the government was really cheating the figures. So there is a level of anger and outrage, certainly among NHS staff, that they are essentially frontline soldiers without the equipment they need to fight this battle.
Right, and this at a time when the UK continues to see a strong surge in infected cases and even the death tally growing up due to the inclusion of deaths from nursing homes and daycare homes.
Yeah, that surge of numbers were really over the same space of time. And this is really important to consider as well, that certainly the frontline NHS staff had short of PPE, but also those nursing homes, those care homes where those extra deaths were happening also didn't have these vital PPE. So there will likely be an inquiry after the fact on how Britain was simply ill-prepared. They had already practiced crisis scenarios, a future pandemic, and it was highlighted when they ran those tests 2-3 years ago that one of the essential items they would need is personal protection equipment. So how come the country didn't have it in stock? Those are the type of questions they'll have to answer in a few months down the line after, hopefully, this crisis is under control.
Mandy Clark, our London Bureau Chief, joining us with that latest ground report. Thank you so much for being with us here on WION Dispatch.